Medlaw Express.
In this video, we'll explore how summary and VMR software streamline handling a personal injury case, using John Doe's case as an example. Here, we see the initial overview provided by the software. It organizes data into clear sections, so lawyers can quickly access the information they need, such as radiology, lab reports, medications, and vital records. One of the most critical tools is the event chronology, which shows all medical events in a timeline. This feature allows attorneys to understand the sequence of events and track key developments in John's treatment, such as ER visits, tests, and diagnosis. In the Disease and Procedure Mention section, the software flags significant diagnoses and treatments, including any conditions directly related to the injury. This enables quick review of John's primary complaints and relevant medical history. Radiology reports are critical for assessing injuries. Here, the radiology section shows diagnostic images along with interpretations from providers, which can be crucial in understanding the extent of John's injuries. Keeping track of medications and vitals over time helps lawyers evaluate ongoing care needs. This record of medications and vitals also provides evidence of John's post-accident treatment and any new prescriptions resulting from the incident. The software summarizes each provider's involvement, which is especially useful if an expert opinion is needed. With a breakdown by provider type, it's easy to locate information from specific professionals, like emergency room doctors or physical therapists. The ICD-10 coding tool extracts and lists medical codes, aiding in analyzing treatment patterns. These codes provide a standardized view of John's medical needs, making it easier to connect treatments to specific injuries from the accident. The software's billing data section compiles charges related to John's treatment. This data supports financial claims for medical expenses and helps ensure all costs are accounted for in any settlement. Meet John Doe, a 47-year-old man who was involved in a motor vehicle collision. It was a rear impact accident where John's car was hit from behind and then pushed forward into a tree. John was wearing a seatbelt at the time of the accident. Despite the lack of airbag deployment, the impact caused him to briefly lose consciousness and led to various injuries, including neck and back pain, as well as pain in his left wrist and right leg. Following the accident, John was taken to the emergency department, where he reported significant pain in multiple areas, including his head, neck, and back. Initial vitals showed elevated blood pressure at 219/113 and a pulse of 86. Upon examination, medical staff noted that John had abrasions on his left wrist and right lower leg. Imaging tests revealed a cervical spine fracture at the C6 and C7 vertebrae, which required immediate stabilization with a cervical collar. John received pain management with medications, including morphine and fentanyl, to manage his discomfort. Due to the severity of his spinal injury, he was transferred to Grady Trauma Center for specialized care. John was diagnosed with a cervical spine fracture, lumbar and thoracic strains, and multiple abrasions. He was prescribed medication for ongoing pain and blood pressure management. His condition was stabilized for discharge, but his recovery journey had just begun. By organizing John Doe's medical history with VMR software, attorneys save time and gain insights needed for a successful case. This approach enhances case preparation and ensures that nothing is overlooked in representing personal injury clients.